Delighted to be able to join everyone this afternoon to talk about where we are with respect to COVID-19 across the state of Maine for today, Tuesday, February 23rd, 2021. I begin this afternoon's update on a sad note. The Maine CDC is reporting 2 additional deaths today. Both were residents of Oxford County. One was a man and one was a woman. One was in their 60s, the other was in their 80s. Their passings come a day after the United States surpassed 500,000 COVID deaths across the country, 660 of which were Maine people. I'd like to take a moment to acknowledge these deaths. Each and every one represents a loss, a hole in a community, a gap in our lives. Each of these individuals was somebody's friend, family member, or work colleague. Each was someone's son or daughter. Each was a source of support and light to somebody else out there. And each and every one of them will be missed. Right now in Maine, there are a total of 43,736 cases of COVID-19, representing an increase of 142 cases since yesterday. Of those, 34,634 are confirmed, and 9,102 are probable cases. Overall, 1,511 people have been hospitalized, and right now in Maine, there are 67 people who are in the hospital. 25 of them are in the critical care unit, and 7 of whom are on a ventilator. As I mentioned a moment ago, 660 people have died related to COVID-19 since we began our work on the pandemic. Now some updates on where we stand with respect to testing. Our positivity rate has continued to come down since the last time we spoke. It now stands at 1.13% for PCR tests on a 7-day basis, with a corresponding PCR testing volume of 614 tests for every 100,000 people. We've seen similar moves with respect to antigen testing, where the 7-day positivity rate there now stands at 3.2%, with an antigen testing volume of 142 tests for every 100,000 people. Turning next to vaccines and vaccinations. Let's do the numbers first. There have been a total now of over 300,000 vaccinations administered in Maine since we began our work on vaccination back in mid-December. 301,705 total cumulative vaccinations to date. Of those, 202,761 are first doses. 98,944 people have now received both of their doses of COVID-19 vaccine. To put those numbers in perspective, over 15% of Maine people have received their first dose of COVID-19 vaccine, and 7.3% of Maine people have received both doses. If we zero in on those 70 and over, 54% of Maine people aged 70 and over have received at least their first dose of COVID vaccine. I'd also like to talk about expansions in places now where individuals can obtain COVID vaccines. I'm pleased to announce that Walgreens will be offering COVID vaccine at more than 40 locations across Maine. The registration process should be opening at some point today, and the first shots may be available as soon as tomorrow. Again, Walgreens will now be offering COVID-19 vaccinations at more than 40 locations in Maine, with registration ideally opening up today, with first shots being delivered as soon as tomorrow. While we're on the topic, we've also been working with Walgreens to expand not just COVID vaccines, which they will start to be offering, but also PCR testing. There are 4 Walgreens locations in Maine that will now be offering and providing PCR testing. Those are the Walgreens locations in Machias, Holton, Biddeford, and Bethel. A number of other Walgreens locations continue to offer antigen tests, but these 4 locations offer PCR testing as well. And this comes in addition to now more than 40 locations that will soon be offering COVID-19 vaccines as well. I'd also like to note that thanks to the continued efforts of our friends at Northern Light Healthcare, working with the Cross Insurance Center in Bangor, there are continuing to be appointments available for COVID-19 vaccination at the Cross Insurance Center in Bangor. I checked in with the team there earlier today, and again, because of efforts they've been undertaking, there are slots available. If you are 70 plus and going to Bangor is available to you, please schedule your appointment now. In particular, slots are open and available for vaccination clinics this Thursday as well as Saturday. So again, if you are 70 plus and going to Bangor is available to you, please schedule your vaccine appointment as soon as you can. You do not need to be a patient of Northern Light Healthcare in order to be vaccinated at the Cross Insurance Center in Bangor. The best way to access that is either by phone, where you can call 207-204-8551, or to sign up online at covid.northernlighthealth.org. Again, I'll read those numbers really quickly again. The phone number to call is area code 207-204-8551 or covid.northernlighthealth.org. Again, there are appointments available for this Thursday and Saturday at the Cross Insurance Center in Bangor. I'd like to take a second to thank everyone who is involved with these public-facing, large-scale vaccination centers, both our friends at the Cross Insurance Center, as well as our friends at Scarborough Downs. All of these sites are essential to helping us reach our vaccination targets. I have received nothing but rave reviews about the experience of being vaccinated either at Scarborough Downs or at the Cross Insurance Center. And again, I'd like to take a moment to thank the staff and those who are organizing both of these large-scale centers. This is no easy task to pull something like this off, a site that can easily vaccinate anywhere from 1,000 to 2,000 people per day. And I just, again, would like to thank all of the staff and organizers of these locations. The experience that's been conveyed to us has been nothing but uniformly positive. And finally, before we turn to some questions this afternoon, I'd like to take a moment to discuss where things stand with respect to vaccines across the country. In particular, I'd like to zero in and talk a little bit about a vaccine candidate that's been made by Johnson & Johnson and their partner Janssen Pharmaceuticals. This is a vaccine candidate that later this week will be evaluated by expert advisory panels associated with the US FDA and the US CDC. If those panels move to recommend authorization of this J&J vaccine, it could start to be distributed across the country. We have received a number of questions about how this vaccine stacks up against other vaccines and ultimately what the data say about this new vaccine, and even more ultimately than that, whether someone should feel comfortable taking it. I'd like to answer all of those questions today. Now, you may have heard that the J&J vaccine differs from the 2 existing vaccines in a couple of different ways. For example, it only requires 1 dose. But that's not actually what I want to focus on today. You may have also heard that it does not require ultra cold storage, which is true, but not what I want to focus on today. You may have heard that it doesn't even require a regular freezer. That's also true, but not what I want to focus on today. You may have heard that it can be manufactured at significant scale. Indeed, the manufacturer has indicated that there may be 100 million doses available later this summer, which is also true according to the manufacturer. But that's not what I want to talk about today. What I want to talk about today is the question that's come into us the most, which is the effectiveness of this vaccine. Let's first start with what the data from the clinical trials showed. Now, the clinical trials that were done to evaluate this J&J vaccine involved almost 44,000 people from a number of countries across the globe. And the bottom line, after all of the data were analyzed, is that this vaccine is 85% effective in preventing severe COVID-19 across all the regions at which it was studied. Specifically, this vaccine was found to offer complete protection, a 100% reduction against both COVID-related hospitalizations as well as COVID-related deaths, starting 28 days after the single dose of vaccine. There was a clear effect of the vaccine on COVID cases that required medical intervention, such as a hospitalization or an ICU admission or being on a ventilator. And there were no cases among all of the individuals who received the vaccine where any person who got the vaccine needed to be put into an ICU, needed to be put on a ventilator, or thankfully ended up dying. I want to say that again. For the things that matter, for example, severe disease or hospitalization or death, there was a striking reduction as a result of the J&J vaccine, an 85% reduction in severe disease and a 100% reduction in the need to be put into an ICU and thankfully the possibility of death. But you may have heard that this vaccine doesn't compare favorably against the data from the Pfizer and Moderna vaccines. And you may be wondering, gosh, maybe I should hold out and wait for the Pfizer or Moderna vaccine. I want to address that straight on today. Let's first start by talking about the data. Now, first of all, it is the case that this 85% might look at first glance different from the 94 or 95% that you may have seen associated with the Pfizer or Moderna vaccines. But let's first start by zeroing in on what matters. The reason that we vaccinate folks, the reason why vaccines are so critical in the middle of a pandemic is to avoid severe disease, hospitalizations, and deaths. That is the reason why we rush to vaccinate those who are the most vulnerable, like the elderly, because we want to keep them out of the hospital, off of a ventilator, and alive. And on that score, the J&J vaccine performs just as well as the Pfizer and Moderna vaccines. It keeps people alive, out of the hospital, and off of a ventilator. Indeed, in the clinical trials for all three of these vaccines, all three of them showed 100% efficacy at keeping people alive, keeping them out of the hospital with severe disease, and keeping them off of a ventilator. Those are the things that matter. But you may still be wondering, well, gosh, okay, that all sounds good, but explain to me why the J&J vaccine might have this 85% number while the other vaccines have higher numbers. Well, there's a couple of things going on. The first is that in these different trials, there were different so-called endpoints, the things that the clinical trial scientists look for when they are evaluating the performance. And in the Pfizer and Moderna vaccines, they use different endpoints. For example, one of the trials used any type of COVID, whereas the trial for J&J used severe or moderate degrees of illness. So on some level, they are not really comparing apples to apples when you are looking at 95 versus 85, because the things that they were measuring were slightly different. There again, though, for the things that we care about, hospitalizations and deaths, they were all 100% effective. There were other differences, however, between these trials. The Pfizer and Moderna trials occurred last summer. a time when these variants that we've talked about had not yet emerged or were not well characterized. The J&J trial, however, occurred later in time, in the fall and into the winter. And it also deliberately included parts of the world where the variants have now come up. For example, South Africa. All of that suggests that the vaccine, that because of the different timing, the J&J vaccine was being tested at a different epidemiological point in time and in a different set of parts of the world, South Africa and Brazil, where variants that might be more contagious and pathogenic have started to emerge. Again, there may not be a direct apples to apples comparison. But here's the real question that's on everyone's mind. What does all this mean for me? And what vaccine ultimately should I get? Well, here's what it means for you. As more vaccines come online, it's not vaccine against vaccine. It's vaccine against virus. And all three of these vaccines are effective against what we care about: severe COVID disease and death. So what does that mean for you? Well, I'll tell you what I've shared with my own mother, as well as family members who have asked me this question. And here I've been unequivocal. You should get the very first COVID vaccine that is offered to you. All three of these vaccines are 100% effective at preventing what matters: hospitalizations and death. In the middle of a pandemic, with disease all around us and the possibility for potential spikes again, potentially caused by the variants, if those were to take hold, the best thing that you can do, the best health decision that you can make for yourself, is to take the first COVID vaccine that is offered to you. In a pandemic, waiting for the vaccine you might want rather than the vaccine that you have offered to you is not a wise move. And so when the COVID vaccine is offered to you, I recommend that you take whatever vaccine is presented at the time you are eligible and at the time you are able to get a vaccine. There may be a time in the future where these differences matter. But right now, for where we are in the pandemic, getting vaccinated as quickly as you can with a vaccine that will keep you out of the hospital and keep you alive is the best thing that you can do. So with that, I'm going to turn things over to our colleagues in the media this afternoon. The first question goes to Patrick Whittle.
Thank you very much. I have a couple of quick things. You touched on this a moment ago about the declining positivity rate. It seems like there might be sort of a corollary there with the volume of testing. Could you talk a little bit more about that? And also, could you talk about what other factors might be driving the positivity rate down, because we're sort of approaching sub 1% at this point?
Yep. Well, let me offer one more piece of data around that, Patrick, and explain how to think about positivity rate in connection with the testing volume, or how I think about it. Let's take a look back and take another look at when the positivity rate in Maine was last at the rate that it is right now. And when you take a look back, you find that that was around November 2nd or so, when our positivity rate was 1.06%. So we are, in epidemiological terms, looking at the same degree of approximate transmission that we were seeing back in early November. So then let's take a look at our testing volume back in November relative to our testing volume now. Back then in November, the testing volume was around 550 tests per 100,000. Again, by comparison, today, right now, we're at about 613 tests per 100,000. All of that is to say, we're doing more testing now than we were back at that point during the pandemic. And our positivity rate is correspondingly lower than it was. So we're doing more testing now with a lower positivity rate. What does that mean? It means that I have even more confidence that the positivity rate and the reductions that we have seen in the recent week or two are real. They are not a function of diminutions in testing volume, although there have been fluctuations. But because we are doing more testing than we were before, it increases my confidence in the positivity rate, and that the reduction is in fact a reduction in transmission. So what's going on there? Why is the positivity rate falling? The bigger question there, Patrick, is in general, why are cases falling? And there's much to be said about that, but in big picture terms, there's a lot happening. I think it's a mixture of regression to the mean after a very significant January spike. So a little bit of regression to the mean, some of it being improved mask wearing, and then some of it may be a combination of different degrees of immunity starting to take hold in small terms.
Okay, thank you for that. Also, the proposed COVID-19 Patients' Bill of Rights received its first hearing today at the legislature. I'm curious if the DHHS or the CDC has any position on that, or is going to offer any comments about it in the way that state departments sometimes do regarding legislation of this kind.
Yep. So I haven't been able to listen to all the hearings. I was receiving updates from members of my team throughout the hearing. We have been very deeply involved, working with our colleagues in the legislature to make sure that the legislation addresses some of the obstacles and hurdles that we see potentially on the horizon. For example, around things like who may be eligible to be vaccinating, things of that nature. But in terms of formal written comments, I will check with our team to see where we are in that process. Certainly, again, we've been deeply engaged with our colleagues in the legislature around working with them to include concerns that we see. But whether we are submitting formal written comments, again, I'll check on that for you and we'll get back to you.
Okay, thank you for that in advance.
Okay, thanks, Patrick. Let me turn it over to Jessica Piper at the BDN.
Thank you, Dr. Shah. First, I wanted to ask, some of the DHHS guidelines for providers to request vaccines mentioned steps taken by an organization to promote equitable administration of vaccines. And I was wondering if you could talk about kind of what you're looking for there and how equity is considered when the state's deciding which providers to allocate vaccines to.
Sure. Jessica, just to be sure, I think what you might be referring to is an application to be for individuals who may want to come together in a consortium. Is that right?
That's possible. I wasn't sure if it was for that or providers generally, but if you think.
Well, I mean, I ask not because it really makes a major difference, because equity is a concern and that runs throughout how we've been thinking about vaccinations. So let me offer a couple of different things that we are looking at as evidence for ways to demonstrate, for providers to demonstrate their commitment to equity. Some of them are relatively straightforward. For example, are they vaccinating outside of their patient base? That is to say, have they thrown open their doors to those who may not actually be patients of that practice, but for anybody who may not be a patient who still wants to be vaccinated? The other is, are they thinking about access in ways that we find to be really meaningful? So are the hours such that folks may be able to access them? Is the way to sign up something that is easily accessible to all? Do you necessarily need to have a smartphone? Is there a phone number to call? Things of that nature. So those are just some access-based equity things that we look at as we're thinking about whether these consortia fill needs that we have. Now, in terms of making allocations, we do take equity into account there as well. So, for example, one of the metrics that we look at is, given that right now our one of the areas of focus is those 70 and over. We take a look at what percentage on a county by county basis within each county, what percentage of those 70 and over have we actually vaccinated? And where we see potential disparities start to open up, we try to right those by making sure we're sending vaccine to areas of the state to make sure that those disparities don't open up too widely. So that's one of the ways in which we do take equity into account as we're making week by week distributions.
And you mentioned practices that are maybe only administering the vaccine to their own patients. Is there a potential that the state would be reducing its allocations to those providers in the coming weeks, or?
We take the opposite approach, which is to work with those providers to open up their doors. And thus far, when we've had that conversation with, for example, large multi-specialty practice groups, when we broached the conversation with them weeks ago about opening up their doors to non-patients, the response we've received uniformly has been, yes, we can do that. It might take us a little while to make sure that our scheduling platform is open, so on and so forth. But thus far, what we've heard from folks is, sure, we can make that happen, but we might need a little bit of lead time to get there.
And then have any of the consortia you were just talking about been approved yet? Are any of those in practice yet?
Oh yeah, I know that for certain, the consortia in Aroostook County and Northern Penobscot County, associated with PCHC, both of those have been approved and are receiving vaccine. And then we are evaluating another application that we agree with from a group in Washington County. Now it's just a matter of making sure we've got sufficient vaccine for it. So the answer is yes, no question about it.
Thank you.
Let me turn to Mal Meyer next.
Yes, thank you so much, Dr. Shah. Commissioner Lambrou said Maine would move on to people 65 to 69 as early as next week. Is that still possible, especially since 46% of people 70 and up still have yet to get their very first shot?
So, Mel, a couple of notes. The first is we are still in a situation where supply governs the speed with which we can move to other groups to offer vaccinations to. And although we are hopeful that our supply of vaccine coming into the state next week will continue to increase as it has in the recent few weeks, we don't know what the ultimate supply will be until it's locked by Operation Warp Speed. But that supply is what really governs how quickly we can move. But the second is, although you're correct, a large number of those 70 and over are still getting their first doses. We haven't taken an approach that says 100% of people 70 and over necessarily need to get their first dose. We know that these things are like dials. We will start turning up the dial on the next category, even recognizing that there may be folks who are in the initial category who have not yet received their vaccine. That's because we don't want there to be too many open spots on the calendar. The third thing is, to the heart of your question about what does this all mean for next week? Well, we're taking a look at that. Again, to synthesize all of those things, we're taking a look at what the supply of vaccine that we may be getting next week is. Hopefully, we'll find out in the next 36, 48 hours what the locked number will be. And then comparing that against two other variables. One, how many more folks do we have to go? And then the third that I think is really critical, which is how many open spots are there? If there are open spots, then that's a good signal to us that we can start to open up the categories to start filling those spots, recognizing that those 70 and over may not have all been vaccinated, but doing so knowing that there is capacity online.
You mentioned the biggest constraints obviously still being the supply of vaccine. Will the addition of the new Walgreens locations change how much Maine is allocated?
Yes, but I'm glad you mentioned that, Mal, because this is an important point that I should have mentioned earlier in my remarks. The supply of vaccine that is being utilized by Walmart as well, and now starting soon, Walgreens. Again, the supply that's being used by Walmart now and soon Walgreens is distinct from and separate from the other supply that comes into the state that is allocated by Maine CDC and DHHS. That vaccine that is going to Walmart and Walgreens comes from a separate federal supply. So by activating Walmart and now Walgreens, we are not taking vaccine away from other consortia, per Jessica's question, or the large-scale vaccination sites that I've talked about in Bangor, Augusta, and elsewhere. So they are distinct. All of it is in service of getting as many Maine people vaccinated as quickly as possible.
Okay, and then I have one last question. What does the Maine CDC tell business owners to do when a staff member tests positive? Some business owners told our reporter Blair Best that they're not getting enough guidance.
Well, it really does depend on the business. So it really varies. It depends on how long the person had been in the office. So there's, generally speaking, what a business must do is what any other group that might have been exposed must do, which is to ensure that they've gotten a handle on the workplace environment. We will work with them to identify contacts. We will work with them to identify what those contacts should do. We will work with them to figure out where they can get testing. But it's a very fact-specific inquiry. I'm sorry that there are businesses that feel that they haven't gotten everything they need. But at the same time, it does vary based on how many people, where, how long they were in the office for. So all of that guidance is available on the US CDC's website as well.
Thank you.
Let me turn next to Patty White at Maine Public.
Thanks, Dr. Shah. We got a question from a listener who said that they've got a relative who was supposed to get a second shot this Friday, but their appointment was canceled because the second dose wasn't available. I'm just wondering, how widespread is this issue? I mean, are you aware of clinics not getting second doses when they're supposed to?
Patty, there were some delays in other states regarding delivery of second doses. Much of this had to do with ground stops in Louisville, Kentucky, and Memphis, Tennessee, which are the hubs for UPS and FedEx. And because of the ground stops or the delays in travel, I don't know if there were ground stops recently, but because of the delays in travel because of weather, there were some states that experienced significant delays in both first and second doses. We did not have any delays in our first doses, but there were a little bit of a delay in second doses, which are typically delivered today and tomorrow. So it's not clear to me that Friday's vaccination efforts would be necessarily affected, but without knowing the location, I can't comment. It's possible that one particular location didn't receive something on time and preemptively canceled rather than having to cancel the morning of. Again, without knowing the exact location, I can't comment more concretely than that.
Do you have any concerns about having enough second doses available?
Generally speaking, that has not been a concern. Again, for most of the sites, although they may have had a couple of hours or even a 12-hour period where second doses were not in on time, first doses can be used as second doses. There is not necessarily any delineation either in substance or in marking or packaging between a first dose and a second dose. So what we indicated to clinics is that if your first dose is still a couple of hours away on the UPS or FedEx truck, it's okay to use first doses because they are completely interchangeable. But no, I don't have significant concerns about the supply of second doses, both this week or in general.
Okay. And can you give any context to the available slots at the Cross Insurance Center in Bangor? Is that an indication of anything, that they've kind of reached kind of capacity or all the people who are eligible, or is it an indication of anything? Yeah,
I'm glad you asked that, Patty. When I was chatting with them earlier today, that was essentially the question I was raising as well. I think it's a couple of things. I think it's their continued efforts to expand and increase capacity. I think they have also vaccinated a lot of folks. And I think they're also making sure they've got a steady supply of vaccine. So I don't think it's any one thing, and I certainly don't take it as evidence of anything other than me wanting to make sure that slots are being filled.
Okay, thank you.
Yep. Let me turn next to Ashley Blackford at WAGM.
Hi, Dr. Shah. So now that a number of nursing home residents and staff have received both doses of the vaccine, do you know if there are any plans in place to ease up on visitor restrictions?
Ashley, what I will say is that I don't know that I would use the word plan. What on our end, what we've been doing is working with one of our sister agencies to evaluate the data around the safety of moving back towards some of those visitations, as well as other activities, because we know how important they are to making sure that those who work there, those who live there, don't lose that social connection. So we know how critically important that is. Right now, we're at the evaluating data phase. We also know that the US CDC is simultaneously evaluating the data around, in effect, what it means to be vaccinated. And we're eager to hear what their analysis is so we can match it up against how we're thinking about it. We're not alone in doing that. I know a number of other states are undertaking the same analysis, looking at what the federal CDC as well as federal CMS Centers for Medicare and Medicaid are undertaking. I don't know that we have any immediate plans. Again, I think right now it's about evaluating the data. Let me turn now to Amy Brown next.
Thank you, Dr. Shah. Just first to clarify, when you give the percentage of Mainers that have been vaccinated, are you including all Mainers or only adults?
Oh, good question, Amy. It's all Mainers. So it's the census number, 1,344,000.
Great. And I have a couple of questions from listeners. Actually, I have several this week, but I'll just start with the first two. If things remain steady as they are now or continue to improve, will the CDC be updating guidelines for indoor dining and live entertainment in restaurants? And what is in the early stages of planning for the tourism season and what that might look like this year?
Yep. Glad you raised that, Amy. That has been a discussion that's been underway even before we had the recent downturn in cases, the very thankful downturn in cases. We've been thinking about where we go from here, both very tactically, concretely, as you say, for example, with things like indoor dining, but just more generally, for example, what does it mean around the summer, tourism, things of that nature, travel guidance, things like that. We are evaluating all of those things in light of emerging data around the efficacy of the vaccine. See, for example, the J&J vaccine I talked about, as well as the continued downturn in cases. So we're evaluating those things. We've already started to make changes, Amy, and I don't want to leave those to the side. For example, a couple of weeks ago, Maine CDC announced that if you've been fully vaccinated, you don't need to quarantine if you happen to come into close contact with somebody who later turns out to have COVID. That is in recognition of how spectacularly effective these vaccines are. We're now evaluating, and with that same mindset, recognizing how good the vaccines are. What does that mean for other areas of life, for other activities that we are all craving to get back to, like dining, like congregating with our friends, like summer travel? We're working on all of those right now, no final decisions, but as we've started to roll out recognitions of being vaccinated, whether it's quarantine, as well as some others, I expect we'll continue to evaluate for some of these other areas.
Great. And another listener has been putting off some needed home repairs in hopes of getting an answer to this question first. They wanted to know how long they should leave their windows open after a repair person had been in their home. The repair person will be wearing a mask. And also, should they wear a mask for a period of time after someone has been in their home?
After someone has been in their home?
Yes, if they had a repair person in their home working on, say, the plumbing or something, and the person was wearing a mask, they're wondering if they should open their windows for a period of time and how long that would be after the person leaves. And also, should they themselves wear a mask for a period of time after the person?
Yeah. So they don't, again, there's many variables to this, Amy, and I can't comment on specific cases. There's just too many unknowns to make anything I would say to be applicable. And so it's difficult to really weigh in on case by case scenarios, particularly in a public press briefing. But that being said, much does depend on whether the person, by either the homeowner or the employee, have been vaccinated. Much depends on the size of the residence, the size of the room, the duration for which the people are there. So there are a lot of variables. So I can't give a specific answer, but in general, everyone should be wearing a mask. It's good to keep the windows open while people are there to ensure maximal ventilation. If you can do so for a period of time after people leave, that's desirable. But in terms of wearing a mask afterwards, generally speaking, there's not a need to do so unless you later find out that the person had COVID or something of that nature. But masking after the person leaves, provided there's been ample ventilation, is not generally something that needs to be done. But in terms of the specifics around how long do windows need to be open, those are questions I can't answer without knowing all the facts, the layout, the size of the room, the duration of the exposure, things like that.
Okay, great. Thank you.
Let me turn it over to Allison Ross next.
Hi, Dr. Shah. Thanks so much for taking my question. So to start, when the vaccine opens up to this next group, I think you're talking about the 65 plus group, everyone, of course, rushes to get an appointment and it backs up the system. So are we now more prepared for that rush? And is there any update on that statewide website and the phone line?
So let's start with the latter. We are continuing to work with providers who are open to using that statewide system to bring that online. We're still a little bit of ways away. We've encountered some bumps, as one would expect with any multifaceted, multi-stakeholder IT project. And right now, the focus, Allison, is to identify those providers who are out there vaccinating. For example, like the consortia that Jessica talked about earlier, to get them online. There may be other providers who've already got their system pretty well oiled, and they don't see a need to be part of the scheduling tool. We may already have a link for them so that folks can just click or call and go ahead and schedule, but they may not see a need to take their current system down and sign up with our system. The transaction costs of moving away from a system that they have that already works and abandoning that just to move to our platform may not be worth it for them, particularly because there may be unforeseen challenges. So we are working to bring all of those things online. Now, in terms of the possibility of there being a slowdown or even worse, Allison, I'm not going to lie, that's a possibility. Let's just be straight about that. Other states that have moved in this direction to expand their offerings, states that don't necessarily have as elderly of a population as we do, have moved toward other groups sooner than we have because they have smaller populations in the age brackets we're talking about, and they have seen IT challenges. One of the vendors indicated to us, or rather one of the IT folks that's working on this indicated, is that anytime you open up to a new group, there is that possibility. It can last anywhere from 4 to 12 hours. Massachusetts experienced something almost identical to this just about a week ago. I think we're better prepared. We have a better estimate of the demand, both on the IT side as well as on the phone side. But Allison, I don't want to rule out the possibility. It's a risk. It's a risk that evinces, however, the demand that is out there for vaccines. And so while I know it's going to be an inconvenience, especially if the system slows down, I also want to recognize that it means that there is a lot of demand for vaccine, and I hope that we can satisfy that demand as quickly as possible.
Right. And then one final question here. With the Johnson & Johnson vaccine potentially getting emergency use authorization, I know you're talking about expanding to the 65 plus group, but could the state also be considering at that point then opening it up even further? Would we have enough supply to maybe then continue on to a group like teachers?
Well, so let me first take a couple of points of your question, Allison. Number one, you are correct. Supply governs speed, and speed governs how we open up to further groups. So if we receive a high number of vaccines of any manufacturer, Johnson & Johnson or the others, that will help us plug into our analysis of what that means for potential opportunities for vaccination. So supply continues to govern speed. But let me talk more generally and what those groups are, whether it's others in the 60 plus category, whether it's others who are on the front line, so on and so forth. I can't speculate on that. That's really something that's under discussion right now. But let me just more generally talk about how the J&J vaccine will be deployed. There is concern that the J&J vaccine may be used in different groups that should otherwise be getting the Pfizer or Moderna vaccine. And here's what I want to say about that, Allison. The way that I am thinking about the J&J vaccine is that it's not about who is getting the vaccine, it's about the venues in which it is best to be administered. Again, given that it only requires one dose, it doesn't require ultra cold or even regular freezing conditions for storage, given that it can be somewhat portable as a result of that. We're planning to deploy the J&J vaccine not by population, but by the type of folks that are using it. Folks that might be going out in the field, like public health nurses or independent pharmacists or EMS clinicians, who we are dispatching to the field to bring vaccine to people. The J&J vaccine is perfectly suited for that application. So again, it's not who's going to be getting the J&J vaccine. It's going to be whose hands can we put it in so that it will be maximally used.
Great, thank you.
Yep, thanks, Allison. Let me turn to Chris Costa next.
Hi, Dr. Shah. Thank you so much for taking my questions. I wanted to start with talking about just the effectiveness of vaccines in general. There was some news that had come out about a first dose of, either the Pfizer or Moderna vaccine being highly effective. Is there any consideration by the Maine CDC to extend the amount of time between a first and a second dose? And would that allow more people to get their first doses?
Well, Chris, all the questions you raise are the right ones, but there is one important note, which is really ultimately those decisions are made by the US FDA. They are the ones that issues the emergency use authorization, which is literally a document that spells out the manner and process by which the vaccine can be administered. There is an open question about what leeway states have to disregard what the FDA has said. Certainly individual clinicians may have that, but whether any particular state can say, we don't see it that way, we're going to do it our way, it's unclear. And that's why you haven't seen states go out in front and say, we're going to do this our own way. That's really the expertise that the US FDA has, as well as the US CDC. They really have the just decades upon decades of scientific experience evaluating the trade-off between delaying the second dose and, as you noted, potentially vaccinating more people now versus potentially creating unforeseen consequences. For example, on Sunday, Dr. Fauci, when asked this exact question, was cautious. He expressed skepticism toward delaying the second dose out of fear that the duration of immunity that you get from just one dose may not last that long. Indeed, as he put it, we don't know how long it lasts and what the consequences of that may be. Dr. Fauci, the US FDA, the US CDC, they've got decades of expertise evaluating these questions. We're going to wait and see where they land and then go from there.
Got it. Had a couple, one more question for you here. This is from one of our other reporters who's saying, asking about people opting out of the vaccine. I guess there are some people that she's spoken with that are opting out of the vaccine because of what they consider to be a lack of information available. What would you say to those people who are making that choice?
Well, I think what I would say to them first is, what information would they like to have? What questions do they have that are outstanding that we or others can help them answer? One of the things about this set of vaccines in particular has been the utmost transparency with which the development, study, evaluation, authorization, and now administration of the vaccine has been undertaken. And so I guess, Chris, the first question on the table is for those who are hoping or wishing that they had more information. What are the questions that you've got that we can help you answer? Indeed, Chris, as you know, that's one reason from time to time I've answered questions that directly come into me or my team via email or from social media. All of these sessions, as Patrick once called it, a monologue, all of these sessions that we do are direct and almost verbatim questions that we get because I want to be able to answer people's most pressing questions. But the second thing I would say, Chris, is there is information out there. There are trusted, reliable sources of information around vaccines. We've got a lot of it on our website. The US CDC has a lot of it on their website. The US FDA has a lot of it on their website. That's where I would start for questions around vaccines. All of those places have FAQs with the most frequently asked questions. If you have your question and you don't see it answered there are places where we can help you get answers.
Totally understand. A quick clarification on the Walgreens in-store vaccinations. Those will only be for people eligible under the state's phased approach, correct?
You are absolutely correct, Chris. It will just be those who are either 70 and above or are part of phase 1A in some other fashion. That is correct. Mm-hmm.
Okay. And you had mentioned the Cross Insurance Center and encouraging people who can get to Bangor, again, people who are eligible, to do so. I do remember a few weeks ago, you had also mentioned a concern about people traveling across multiple counties to get their vaccines. Some people, I think, have been driving from York County all the way to Aroostook County because they were in search of an open appointment. Is this situation with the Cross Insurance Center kind of an exception to that concern that you had previously, or have things changed?
Oh, no, so one note there, Chris, let me just step back, and Patty White had asked this too. This is a situation where I was on a call, or I was discussing generally how things were going, and they mentioned that they had open spots. I don't like to see open spots. I don't like to see one open spot. I don't like to see any wasted doses. I don't like to see any of that. And so I offered, as I did last week, to mention to folks that there are open spots. This is not a situation, anything other than that, other than me, as I talk to folks, to say, hey, if you're looking, please, here's a place you can go. Now, to the point you made about travel, though, Chris, right, you are correct. Earlier in the vaccination process, there was not as much shifting or movement of doses across the state. Healthcare systems and hospitals have done so with ease now. And so there's not as much concern around someone from your county, if it's available to them, driving up to Penobscot County. Now that we have these large scale, high throughput sites available, that is in some respects, one of the modes of operation. If driving to the vaccine is available to you, then being able to have one location that can offer and provide up to 2,000, maybe even more doses than that per day, that's a way that we can really utilize as much vaccine as possible. Again, we're in a pandemic, and the more that we can get that vaccine off the UPS truck and into someone's arms, the quicker we can do that, the safer we're all going to be.
Gotcha. So the addition of the mass sites, then the addition of more of those mass high throughput sites is good news.
Indeed, it's part of the concept of operations. We know that driving to the vaccine is not available to everybody. So we're simultaneously looking for ways to bring the vaccine to folks who can't drive. But for those who can drive, that is a place that they can go because there's high throughput, and they can, again, provide 1 to 2, more than 2,000 doses not every day, every single time they have a clinic.
Gotcha. And then my last question here is sort of a numbers question. Do you know how many total Mainers are eligible under phase 1A, and how many of those people have gotten at least a first dose?
Under 1A, okay, I can get you those numbers, Chris. Going again, that's healthcare providers and others. I have those numbers. I don't have them locked away in a manner that I would feel comfortable announcing. I might have some of the digits incorrect, and I don't want to give out incorrect information. So we can find those for you.
Much appreciated. Thanks, Dr. Shah.
You bet. And the last question for the afternoon goes to Joe Lawler.
Hi, thanks. I just have a very narrow topic and then a couple of broader topics. The very narrow topic is, I'm wondering, some states are trying to go middle of the road with teachers and have teachers, say 50 and older. I think Florida and West Virginia are doing this alongside people 65 and older. Is that something that could be under discussion in Maine?
I'm aware of that approach that's been undertaken in some other states. I don't know that we've landed on any particular strategy there, Joe, whether to the larger question around educators, and then to the more narrow question, as you framed it, around different age categories within that. I don't think any final decisions have been made around that. It's under discussion, not to sound repetitive, but really depends on supply.
Okay, and then one of my broader topics is just kind of stepping back for a second about the strategy of releasing the plans on what you intend to do. Like some states have been very specific, like Connecticut, that I think just released a plan where they went through the April and the beginning of May talking about which age groups are going to be vaccinated. Massachusetts has very specific plans. And I know that, I think you had said before that you don't want to overpromise, but at the same time, I think people just kind of generally want to have a general idea of when things are going to happen, or where am I at in the line, even if you can't tell me how fast the line is going to move. So I'm hoping you can address that.
Yep, it's a totally reasonable question. And on some level, I recognize, Joe, that the composition of the line is not so much your place in line is somewhat different from how quickly that line moves. the how quick process is governed by supply, but the place in line may be in some respects irrespective of that. I totally get that. No question about it. It's a trade-off. On one level, there is this desire to provide specificity, or there's a desire for folks to know with specificity exactly what number they have. But at the same time, there's caution on my end because so much can change. And I'm certainly not looking to speak ill of other states, but an interesting exercise would be to go back to some of those detailed plans that other states put out in December, in November, where they did provide calendars and timelines, and see how well those have aged. Is any of those states where they thought they projected they would be in November and December? If they are, and I'm thinking of a couple states in particular that were specific, if they are, then maybe that's a lesson for me. If they're not, and all of those were just words on a page, then I think that tells you, well, or at least vindicates why I'm very cautious about these things. I don't have a great answer there for you, Joe. That's just a glimpse into how I think about these things. I'm naturally cautious about it. I recognize fully that it means that a lot of folks are left feeling like they don't know what their spot in line is. I acknowledge that. I suppose that the way that I have done business in general and throughout the pandemic is when I know something to be the case, that's when I'm ready to talk about it and double down on it. And if I don't know what that is with certainty, I'm just really hesitant and gun shy about making promises that I don't think I can keep.
Okay, thanks. And the very last thing, this should be a fairly easy question. So there was some concern amongst the independent practitioners that they would be able to meet a standard of providing 1,000 doses per week to their patients. And I know there's some talk about collaboration but even collaborating amongst these folks that they may not be able to do 1,000 per week. And they were pointing out, FQHCs, some of them have only had to do 100 a week. I mean, is there any discussion about bringing that threshold down so that they don't have to meet that 1,000 per week requirement?
Well, everything is under discussion. We're in the midst of a pandemic, and I try to be flexible. That's the one rule I'm really rigid about. And so, but I won't really make any bones about the fact that in the midst of a pandemic, throughput matters. Literally every day that we can vaccinate people with the doses that we get in the state is a day that we can start providing and conferring immunity or safety from the vaccines. And so throughput really does have a role to play, particularly when the volume of vaccine we're getting is so limited. So if the volume of vaccine changes such that we're not supply constrained, well, then of course, that's something easy to revisit. But in the meantime, that high throughput means that when we allocate doses, we know that they can be used to vaccinate a high number of people really, really quickly. That's ultimately what we are looking for here. All of that will change as supply increases. But for now, the high throughput approach is one reason why Maine is at the higher end of the league tables when you look at the percentage of folks who have gotten their first shot, the percentage of folks who are able to access vaccine, and our overall throughput. With that, let me just recap what we talked about a little bit earlier, which is how to think about these new vaccines that are coming online. There will be more and more vaccines, let's hope, as we go through the remainder of this year. The first one that looks possible, that may get authorized later this week, is the one from J&J, but there are others. And each of these vaccines will bring with them different panels of numbers. And what I think will be important for all of us to look at is to zero in on the numbers that matter. And in the midst of a pandemic, with now over 500,000 people across the United States who have died, and untold numbers of people who have been hospitalized, put in an ICU, and put on a ventilator, the numbers that matter are those that relate to death and hospitalization and ventilation. And on that score, the J&J vaccine, as well as those by Pfizer and Moderna, are exquisitely sensitive and amazingly effective at keeping people alive, out of the hospital, out of the ICU, and off of the ventilator. And that's why when your number in line comes up, I wouldn't ask which vaccine you're getting. I would take whichever vaccine is offered to you and not delay getting vaccinated. In the midst of a pandemic, the best thing that you can do is to take a vaccine when it is offered to you. And the best vaccine that is out there for you is the first one that you are offered. So with that, I thank everyone for your time today. I appreciate all the questions this afternoon. We look forward to catching up with everyone again on Thursday. In the meantime, be kind, take care of one another. We'll talk again soon.